Hi all, I am Dr. Chitra Mani, consultant obstetrician and gynecologist. This is an awareness video about endometriosis. The endometrium is otherwise called the inner lining of the womb, that is the uterus. In endometriosis, the cells which are in the endometrium, similar to this, the cells are there outside the uterus, which can be on the fallopian tube or outer surface of the uterus or on the ovary or in the lining of the pelvis or in the tummy or even outside the tummy, like for example, in the lung tissue or in the scar site, etc. In this disease, every month when the menses happens, there is a bleeding from these cells, endometriosis cells, and this can lead to inflammation, scarring, and in the ovaries, it can lead to cyst formation, which is commonly called as chocolate cyst or endometrioma. So how common is this? It's quite common. 1 out of 10 women, it can occur from the age of first menses, that is, we call it as menarche, up to the age of menopause, that is the last menses. So what are all the symptoms it can cause? First of all, it can be asymptomatic in some women, and if the symptoms which can be because of endometriosis usually will be pain. This pain can be during periods, which can be mild to severe pain, or in between the periods, and which can be there for a long time. That is called chronic pelvic pain. Or some people, it can lead to bleeding or burning while passing urine, or pain or bleeding while moving the bowels. And some people do have difficulty to get pregnant. So symptoms, some days they'll be very normal, some days they'll be having these symptoms. Because of this, patient might experience some low mood or anxiety, or they can end up in even relationship problems. So sometimes this can cause pain even during or after the sexual contact as well. How to treat this? So it is not easy to treat, especially in some women, and there is no complete cure, but there are effective treatments available to control the disease. Like for example, starting from simple pain medications and medical treatment like hormones and surgical treatment, which is usually laparoscopy. It is this particular condition that is not easy to diagnose. Sometimes it can end up in delayed diagnosis because there are no blood tests to find out. Sometimes there can be nothing when we do the ultrasound or even in the MRI scan or even in the laparoscopy. So basically the treatment depends on the symptoms, severity of the symptoms and what problem it causes. For example, pain or difficulty to get pregnant or other symptoms. After the treatment, either medical or surgical treatment, the symptoms can recur. So patients should be aware of this and then get the proper advice from the doctor in order to reduce the chances of recurrence. So understanding about this endometriosis disease will help the patient and the relatives in order to get a proper treatment. Thank you.